This is Jim Kalaki from the Oklahoman City Desk, and a real authority on end-of-life issues. Linda Edmondson, wife of the State Attorney General, and she's here with us today. Linda, what are some of the controversial issues that happen at the end of life?
Well, unfortunately, there are controversial issues that come up, and part of the reason I work in this area is because I wish there weren't controversy. I think tube feeding, artificial nutrition and hydration is one of the most controversial issues for people. There are times at the very end of life when artificial tube feeding is a burden. It's not a benefit to people. And yet people feel like if they've started that, they have a hard time knowing whether it's appropriate to stop. And sometimes people are afraid to start because they don't know whether they could say no later on or not. Sometimes the very question of whether, if someone's heart stops and their breathing stops, whether they should try to resuscitate them, to do CPR on them or not, or whether there should be a do not resuscitate order written, that's controversial at times.
What do you suggest for people who have parents with Alzheimer's disease? What should they do to prepare?
Well, unfortunately, an advance directive or even that conversation can only be done with somebody who has the capacity to think and talk about their wishes. So if someone has Alzheimer's disease to a point where they're no longer able to express their wishes, it's a difficult situation to be in, because usually healthcare providers will turn to the next of kin and ask, what do you think their wishes would be? What would they want now? And sometimes if you've had that conversation, even if it was years ago, you have a sense of what that person wanted. But if there's no idea, then it's important in Oklahoma, it's important to have the conversation, because
Right.
it's hard to be able to make decisions for someone else if they've not expressed their wishes.
What about hospice care and other end-of-life issues?
I love hospice care. I'm a great advocate for hospice. I was fortunate enough to be involved a little bit in helping to start the very first hospice in Muskogee, Oklahoma, a long time ago.
Tell me what that is. Tell me what a hospice does. And
Hospice provides health care at the end of life that neither hastens death nor delays death. It allows a natural death. It is almost always at home, or it could be in a nursing home, with usually the family or loved ones providing most of the care. Hospice doesn't provide 24-hour care, but they have skilled physicians and nurses that are close by and on call. They have volunteers, social workers, and chaplains. Hospice provides palliative care at the end of life.
Explain that term, palliative care.
It's not well known. I keep using it because I think it needs to be better known and understood. It refers to comfort care, or care that is aimed at relieving symptoms of an illness, usually a terminal illness, when there's no longer any possibility of cure. Hospice and palliative care focuses, I guess you'd say, mostly on pain management or pain relief, but it also deals with other physical symptoms and with spiritual and emotional and psychosocial problems. Palliative care really looks at the patient and the people, loved ones around that patient as a whole system, to say, how can we provide the best possible care, not cure, for all the people involved in this at the end of life.
Give me, say, the two things that Oklahoma families need to do for someone who is near death. What do they need to do? The two most important things.
Well, I would say if the person still has the capacity to discuss their situation, that to have a conversation about what they want as death approaches is the most important. And if they're able to write that down, either informally or by filling out a living will or an advance directive, that's very important. I would also say that it never hurts to ask about hospice care and whether hospice care is appropriate and whether it's time for hospice care. And I guess I have to give you 3. I would also say that almost all pain can be relieved, and people at the end of life should have good pain management and good pain control and not be afraid of asking for help with pain.
I agree. Thank you so much, Linda Edmondson. Appreciate it.
Thank you.